unless you're really finding out where your vitamin D levels are, you're not necessarily going to have great success in staving off osteoporosis and osteopenia, especially as women. Guys start to have troubles with their bone density, muscle density, especially kind of into the 50s, but they really accelerate between 60 and 70. So if you have a husband or this is a guy listening to this and you're in that 60 to 7 range, you really need to listen because it becomes super important, because if you maintain your bone density, you'll maintain your muscle mass, and muscle mass maintains your hormone levels, and that's what keeps us all healthy and living quality of life. So the patient I saw had an injury, and we were able to take some X-rays, and it was able to see pretty significant diminishment of bone density. And I asked the patient, I said, have you been tested for osteoporosis, osteopenia? Oh, yeah, I just went from osteoporosis to osteopenia now. So you went from one level to a little bit less level of density within the bone. And I said, so what's your family doctor doing about it? And she said, nothing. She just told me to stay on my vitamin D level. And I said, okay, great. What's the vitamin D level? And she said, oh, about 400 IUs. So here's this woman sitting in my office with significant loss of bone density, also been tested to show that her bone density is going down. And a family doctor tells her 400 international units of vitamin D is going to be sufficient.